healthcare for millions of Americans, and has led to improvements in healthcare quality and outcomes. One important advance is the use of artificial intelligence, AI, and machine learning in healthcare. These technologies can be used to analyze large amounts of healthcare data, identify patterns, and make predictions about future health outcomes. This can help healthcare providers make more informed decisions and develop more effective treatment plans. Another important advance is the development of precision medicine. Precision medicine involves tailoring medical treatments to an individual's specific genetic makeup, lifestyle, and health history. This approach can lead to more effective treatments and better outcomes for patients. In addition to these technological advances, there have also been important developments in community health and healthcare services that are designed to meet the needs of specific populations. For example, there have been efforts to improve healthcare access for individuals with disabilities, such as the development of accessible healthcare facilities and the use of assistive technologies. There have also been efforts to address healthcare disparities among LGBTQ+ populations, such as the development of culturally sensitive healthcare programs. There has also been progress in addressing the mental health needs of individuals. Mental health services are becoming more widely available and accessible, and there is a growing recognition of the importance of mental health in overall health and well-being. Finally, there has been progress in addressing the global burden of disease, with initiatives aimed at preventing and treating infectious diseases, improving maternal and child health, and addressing the growing problem of non-communicable diseases such as diabetes and heart disease. One important advance is the use of big data in healthcare. Big data analytics can help healthcare providers to identify patterns and trends in healthcare data, which can be used to improve diagnosis, treatment, and patient outcomes. It can also be used to develop predictive models that can help healthcare providers to identify patients who are at risk of developing certain conditions, such as diabetes or heart disease. Another important advance is the use of virtual and augmented reality in healthcare. These technologies can be used to provide immersive training for healthcare providers, as well as to improve patient outcomes. For example, virtual reality can be used to help patients manage pain, anxiety, and stress, while augmented reality can be used to assist surgeons during procedures. In addition to these technological advances, there have also been important developments in community health and healthcare services that are designed to promote health and prevent disease. For example, there have been efforts to improve public health education and awareness, as well as to develop policies and programs that promote healthy behaviors and lifestyles. There has also been progress in addressing healthcare workforce shortages, particularly in rural and underserved areas. Efforts are underway to recruit and train healthcare providers who are willing to work in these areas, as well as to develop telehealth and other remote healthcare delivery models. Finally, there has been progress in addressing the social determinants of health, such as poverty, housing, and access to healthy food. Healthcare providers are recognizing the importance of addressing these factors in improving health outcomes, and are working with community organizations and government agencies to develop solutions. One important advance is the use of blockchain technology in healthcare. Blockchain can be used to securely store and share health information, which can improve patient privacy and data security. It can also be used to streamline healthcare payments and reduce administrative costs. Another important advance is the use of precision public health.